Natural remedies for sebaceous cysts. Natrual remedies for sebaceous cysts include homeopathic remedies like vitamins, herbs, and hot compresses. Sebaceous cysts are cysts or lumps that form under the skin. Although they were generally benign and often disappear on their own, they can be bothersome and unattractive, and, in some cases, can become infected, so it is important to treat them to avoid complications. Natural remedies for cysts on the skin. Natural remedies for sebaceous cysts provide gentle, affordable healing options that often help avoid an uncomfortable medical procedure. Although these remedies are generally considered to be safe alternative treatments, they can cause side effects, so you should always consult your physician or naturopath before trying them. Humid heat. Moist heat, such as a cordless thermal pad. Never use an electric thermal pad together with moisture, or a hot compress, may be applied to sebaceous cysts to help promote drainage and healing. Avoid using a very hot thermal pad, as doing so can sometimes cause an infection by encouraging bacterial growth inside the cyst. If the cyst does not respond to the use of a humid heat, you should consult a physician. Tea tree oil. The National Center for Complementary and Alternative Medicine, NCAM, suggests that tea tree oil contains powerful antibacterial and anti-inflammatory properties. Since many sebaceous cysts are due to bacterial infections, the application of tea tree oil on the cyst may help prevent infection and promote healing. Aloe vera. Some naturalists recommend the gel of this plant as a cure for sebaceous cysts because they believe it fights bacteria and alleviates pain. Medline Plus confirms that some studies demonstrate that aloe vera gel kills bacteria and increases the rate of healing of wounds. Consume nutrients that improve the immune system. A strong immune system helps the body heal from sebaceous cysts on its own. Eating fruits rich in antioxidants, such as whole grains, and vegetables, including berries, citrus fruits, green, leafy vegetables, as well as taking herb-based supplements like red clover and burdock root can help stimulate the immune system and eliminate toxins from the body. Keep yourself clean. To avoid infection, wash the affected area daily with antibacterial soap. A healthy way to prevent sebaceous cysts. Following the steps of a healthy life helps keep the body in optimal health, which reduces the risk of developing sebaceous cysts. Get enough rest. Sleeping less than necessary weakens the immune system and can lead to many problems. So make sure you are getting adequate rest. Avoid refined sugar. The excessive sugar can suppress immune system function, and sickness. To reduce the amount of excess sugar in your diet, avoid sodas, sweetened fruit juices, and processed foods, as well as cereals and snack foods. Reduce stress. Some homeopaths and naturalists believe that stress increases the risk of suffering from sebaceous cysts. In fact, many experts affirm that the excessive stress alters how the immune system responds and can put you at risk for contracting sickness. Learning positive ways to managing stress can be helpful in this case, as in many others. When you visit a doctor, sebaceous cysts that do not disappear on their own may require medical intervention. Consult a physician in any of the following cases. The cyst grows a lot. The cyst grows deeper. The cyst is painful. The cyst shows sign of infection, such as inflammation, redness, or feels too warm to the touch. Infected, enlarged, or painful cysts may require removal by a doctor. It is often a simple procedure that can be done at a normal doctor visit with local anesthetic and usually does not take more time than a normal appointment. The following steps may be taken to remove a sebaceous cyst. First, an incision is made in the cyst. The cyst incision is where the doctor cuts a small opening in the cyst, and the excision consists of the complete surgical removal of the cyst or the removal of the cyst wall. After, the doctor will extract the contents of the cyst to drain it and area is left clean. In some cases, stitches may be required, especially if a complete removal is necessary. Stitches usually may be removed after 1 or 2 weeks. Depending on the location and type of cyst a person has, the doctor can opt to vaporize it with a laser. This procedure leaves minimal scarring. It is rare that sebaceous cysts or their removal cause complications. Never try to open, squeeze, or drain the cyst on your own, and since it can lead to infection, it should be done in a doctor's office. Try natural remedies first. Fortunately, sebaceous cysts are more bothersome and dangerous, and treating them with natural remedies and changing our lifestyles is usually all that's necessary to alleviate the symptoms. However, keep in mind that natural cures for sebaceous cysts do not work all the time. Some cysts don't respond to natural remedies and require conventional treatment. If you have a sebaceous cyst and it is not causing you pain or discomfort, treat it using humid heat, herbal supplements, homeopathic remedies, and/or lifestyle changes before turning to surgical procedures to see if they will resolve the problem.